Morning, everyone. Thank you for joining us for this session on advocating for children with exceptionalities through the CEC Children and Youth Action Network. My name is Jennifer Ward, and I am the Professional Development Coordinator with DCD. And I am here to introduce Dr. Debbie Lively, who will be presenting for us today. Debbie has been a board member of DCD for over 20 years and has served as president-elect, past president, constituent chair for infants, toddlers, preschoolers. She's been a CAN representative and a participant in many special projects through DCD. She's a professor and department chair of the teacher education program at Saginaw Valley State University in Saginaw, Michigan. She received her undergraduate degree in deaf-blind education, her master's degree in elementary classroom teaching with an emphasis in deaf education, and received her PhD in special education with a cognate in educational administration in 2002. Before going to Saginaw Valley State University, Dr. Lively spent 29 years in public education. That is just a short snippet of all of her experiences that she brings to us. So with that, I'm going to turn it over to her to present on this important topic. Thank you, Debbie.
Thank you, Jen. Yeah, I'm excited to be here, and I want to apologize first because my voice, I have been having a little bit of laryngitis. And so if it sounds scratchy or horrible, I apologize. Or if I have to take a drink of tea, I'm going to do that during the session. But I'm excited to be here to share with you why it's so important for you to advocate. Your voice needs to be heard. Okay, so, oops, let me see if I can. And plus, the other thing is I have a broken wrist, so you doing the computer is a little bit difficult. So, all right, so we need to influence, we need to think we are the grassroots efforts that make a difference for policy. You know, I remember as a teacher, I was a teacher back in the early 70s, and we didn't really even have federal legislation for children with disabilities. You know, children were segregated. It was terrible. And Michigan, at least where I'm from, we were kind of ahead of the ball, and we had legislation, state legislation, but there wasn't federal legislation. And it wasn't until 1975 when we had the Education for All Handicapped Act that finally schools, they had to provide services and support systems for children with exceptionalities. Plus, we've gone through all the different things. We've children with disabilities, children with special needs, children with exceptionalities. And I like to refer to it that way because it does include the 13 categories identified in IDEA, as well. It includes the category of gifted and talented. So just so that we're all on the same page. But anyway, so we've come a long way. And I remember marching and advocating at the time, not ever believing that we would come as far as we've come. Not saying we don't have to go further, but I do believe the efforts of all of the volunteers that are in the CAN network do make that critical difference. So if we think about policy that at the grassroots effort, we have to understand what advocacy means. And advocacy is like this organized action, okay? We have an idea or a cause, like we did back in the early 70s about wanting to make sure that children with exceptionalities received a free and appropriate education. So we took it upon ourselves as the educators, and parents were involved too, that we were going to talk to our legislative individuals and say, hey, you need to do something about this. We were organized, we had this idea, and then we went to our constituents. The power of a collective voice is so much more than the power of us as individuals. So if we look, and that's what Council for Exceptional Children has done, they've taken like major topics and organized us around those major topics so that we can advocate not only at a national level, but also at our state level. We all need to be on the same page, okay? We don't need to be an expert. You know, I don't know how many times I've had Puna Tavlin or Deb Ziegler, who was involved before in CAN, talk about how a bill becomes a law. And it's like I kind of know, but I kind of forget too, unless I'm actually involved in the process. But what I do know is that I don't need to be that expert on policy or writing policy, but I am an expert in the field. I have worked with lots of families. I've worked with lots of children who have exceptionalities, and that's what's really important. It's important for us to advocate because we are the experts. If you're deaf or hard of hearing, you're certainly an expert of how it is to be deaf or hard of hearing, or if you have a communication issue or concern. I've been studying my whole life. I think this is my 52nd year in education. And I've been advocating and supporting individuals with exceptionalities for a long time. Our work will be impacted by policymakers' decisions. We can't complain about stuff if we're not going to get up and do something about it. Our voters, we as a voter, we can hold these policymakers accountable. It's difficult, but we can do it. And if we don't speak up, someone else is going to speak up for us, and we may not like their agenda. So it's our responsibility to make that difference. So if we think about advocacy, it's really persuasion. How persuasive can you be when you talk to a legislator? Well, one of the things that I know, years and years ago in Michigan, we had funding for early childhood. We had secondary prevention money, tertiary money, and the governor was going to withdraw that money. And our governor at the time had triplets, and they were born premature a little bit. And I thought, you know what? I had just read this book called Ghosts in the Nursery. And they found that people that were incarcerated had lots of issues with attachment as infants and toddlers. And so I took some of the phrases out of there. So I got a hold of my legislature here in Michigan and said, okay, you pull that money. Where do you want to begin? In the high chair or the electric chair? Where do you want to start? And then I had all this data that showed how it made a difference for children to be involved in early intervention, and how we really help with special education because we found problems early or concerns early and challenges, and we're able to work with them. So that was a solution. Don't take away that money from us. Give us that money. So the governor, I was home and I was called by my legislature. They were playing golf, and he said, did I want that money? That they were giving $3 million back to this thing. So I'm just a normal person, but I think I made a critical difference in that budget decision. They want solutions and innovations. They want us to think, the teacher shortage, what kinds of things are we going to do to make the teacher shortage better? And especially in special ed, it's really at a horrible time right now. We can help them persuade policymakers to make best decisions and choices because we understand it. So really, power concedes nothing without demand. And if we don't demand some of the things that we think are important, then we're not going to go far. To be the key ingredients for being an effective advocate, you have to be a constituent, someone that cares, someone that is going to elect them. We want it so when I go to Washington, D.C., I really hit up the Michigan delegation because Michigan, I am their constituent, and darn it, they better listen to me, right? And I want to present experience firsthand, and I have to craft a compelling case. So using real life experiences, what you see, how the difference the funding has made, or the difference that you made in somebody's life because of their generous funding is really important. And then you have to create a relationship. It's all about relationships with families. We have to create relationships with children. We create relationships with our legislature. We have to create relationships. I often will email my legislature and I will just say, hey, did you know this was coming up? I'd really like you, or I'll send them pamphlets on early intervention and the importance of early intervention. But I try to keep them abreast. I try to develop that relationship. Not only am I involved through DCD at the national level, but I'm also involved in our state through our Michigan Association of Special Administrators, Special Ed Administrators. And we have an advocacy network here, and we advocate here at a local and state level, and then we also advocate at a national level. So when we advocate with CEC, remember, we're a bigger group when we advocate with CEC and their policies. We're educating them about the CEC priorities, and CEC develops policy briefs, and I believe those briefs are available on our website. I sent them a while ago, and if not, I'll make sure the briefs are available for you to look at. We're connecting policy priorities to a member's home district. We're talking about our kids, what's happening in our areas. We're building a relationship with members and staff. Sometimes you don't get to actually see the legislature person, the congressional person or senator, but you do meet their staff, and their staff really help them understand different parts of the legislation with special education. You know, someone said one time that Washington, DC is run by 20-somethings. Well, there are a lot of 20-year-olds, 20 plus, that are really influencing our legislatures. And we really have to establish ourselves as an expert. Remember, you are the expert. You know a whole lot more about special education than your senator or congressional leaders. When we advocate, we do make a difference. I just put this slide up here. There was, in March 2020, there was an emergency IDEA funding request, and that had to do a lot with COVID, but there was 11.3 billion was for Part B. Part B is special education in schools. 500 million for Part C. Part C is infants and toddlers, because with the Part B, every state has to service children 3/21, but it goes actually till their 22nd birthday. But the states require that you service, and that's Part B. Part C then gives funding or money for that birth to 3 population. And every state is different. In Michigan, we provide services birth to 3 through our education. There's 400 million for Section 619. And then there's 300 million for IDEA Part D. That Part D is like professional development, grants to districts. And then over 8,000 letters were sent to congressional leaders in supporting these things. So if I just tried to support this myself, it wouldn't be as effective, but supporting it with 7,999 other people can make that critical difference, okay? So I did want to say too that IDEA, you know, the law was in 1975 was Education for All Handicapped Act, and then that was revised multiple times. And then in 2004, we have IDEA. And in IDEA, there are 6 major components, and those components include the general like definitions and things like that. The first part, Part A. Part B is special education in schools. Part C is that early intervention. Part D is how do we improve the educational services? Well, we improve it by research, by doing evidence-based practices. So there's research grants there. We do it by professional development. So districts and states can apply for professional development. And then we also part of the idea is that the fact that a free and appropriate education, that evaluation, non-biased evaluation assessment is required, that IEPs are written, that we have least restrictive environment, we consider that we have to make sure that parents are full participating in their child's program, their IEP, and then we also have a piece for procedural safeguards. So IEP has these 6 guiding principles, but they have 4 major funding areas. Something you should know that this is a thing that bothers me more than anything. And I'm trying to think when this was, maybe it was 2004 when IDEA came out. The government said they would fund special education at 40%. That means let's say if it takes $100 to finance special education for a child, they would fund 40% of that, so that the states would get $40 for that child. If it costs $100. Well, even as late as 2018, it was they only were funding at 19%. So it's basically they lied to us. They didn't do what they said they would do. So that's one of the reasons that CEC, the biggest thing that they advocate is full funding for IDEA. We must have full funding for IDEA. And the compelling stories that you can tell about children in your districts and how they have succeeded with special education services is important, okay? Now, CEC does have a policy agenda, and I will take you there in a minute. I'm going to just go through the presentation first, and then I'll take you actually to their website. But they do have a policy agenda. I would suggest that you become familiar with that agenda. And again, one of is special education, a free and appropriate education for all children with exceptionalities. The reason that I would ask you to go and look at this site is that you know what they're advocating for and that you can be part of that process. There should be 3 parts to your plan in getting involved. 1, get connected. 2, get informed. Make sure you know what the policies are and get involved. Do visits, volunteer work, whatever you can to make that critical difference. Your voice is really invaluable. What you know will impress the lawmakers, and they are not experts on any of this unless they've had a child with a disability. I remember I went to see the senator that was advocating for universal newborn hearing screening, and I just wanted to let him know. This was after it had passed, and it was before I was there, but I went and made a special appointment to his office just thanking him for what he had done as a champion for infants who had potential hearing concerns, and the universal newborn hearing, they enacted legislation and money for that. But sometimes we need to really thank the legislators when they do something positive for us too. They do rely on outside information for their decisions. And frankly, I'm real concerned about like Twitter and Facebook, and some people think all that is real out there, but the real voice is from you. You make that difference, okay? And that first step, getting connected, you're not on an island. Get involved. If you are interested in being in a CEC CAN or DCD CAN network, get a hold of me, because I would love to have a committee that wants to get involved and that we can march on the Hill in July and we can do things in our own states. You need to find out if you're not familiar with your state and local CEC, you need to find out about that. What is your state doing as far as advocating? Okay, who are the important people? Policy change, remember, it's slow, but it does happen. Okay, I see we changed interpreters, so I'll let us transition nicely to that. We want to achieve our short-term goals, and then while we're working toward reaching our long-term goals, our ultimate goals. And we need to celebrate all those little successes, because frankly, I worked on DCD was a leader in maltreatment, getting a policy through CEC for maltreatment. It took us years. It took a lot of hard work, but we didn't give up. Harold Johnson, who was the champion for maltreatment, he just kept saying, okay, we can do this. We can do this. But I'm telling you, multiple sessions at the conference, multiple times going through the CAN network, times going through the representative assembly, finally getting the board to make action and to make policy about maltreatment. So we had to look at our positive and just had to keep positive, but it took a long time, several years. It just didn't happen overnight. So don't give up. You just keep working toward it. So the next step is get information. We need to know about CEC. You need to know about the legislative process, like how does a bill become law? And we need to learn about your policy makers and the legislator and local school boards. I mean, it goes right back administration in your local districts, okay? So you need to ask questions. You know, what are the main special ed issues in my state? It might not be the same in Michigan as it is in Kentucky. How does a bill become a law? How is the budget? And the budget is at the national level is called appropriations. Who's in charge of appropriations? That's the person. That was when I got the $3 million. I went to the chair of appropriations in the state of Michigan when I got the money back for early intervention. Who, like when we talked about maltreatment, the champion was Harold Johnson. Hands to Voices also had they were working hard on maltreatment. So we needed to get those people involved to help our cause. So the second step is getting information. The third step is getting involved, when to act, what type of action. Remember, you are the expert. You want to personalize your message. You don't want to just do a form letter, but you can take a form letter and you can just personalize it to your needs. Give that story, okay? So we're going to visit CEC's advocacy webpage. I want you to see about that. And we'll go there in just 1 second. But I want you to consider, this is the other thing, in July 9th through the 12th, there is the CEC Legislative Summit. It's put together by the CASE, CEC's Association for Special Education Administrators, and CEC. It's at the Weston in Alexandria, and you can sign up for that. I would love if we had a group of people that would attend from DCD. But anyway, so let's go to CEC. So you would go to the CEC webpage and you go to the section called Policy and Advocacy, okay? And under there, you can see the policy agenda, position statements, white papers, how to become involved in the Children and Youth Action Network, Special Education Legislative Summit that will talk about it, and any coalitions they have going on. The Legislative Action Center is where you go, and they have it all set up that you can connect with your congressional leaders. But right now it's down. They're redoing that piece. So unfortunately, I can't show that to you. But it's super easy. You would just go in there, you would put it to your state in there, and then it will tell your district representatives. And then they have an example letter. So it's really easy. You would just personalize it. And then advocacy basics. Now, Kuna Tavlin, she is the consultant for advocacy. And she is running several little webinars on, you know, the advocacy basics. But if you go here to advocacy basics and you scroll down, there are advocacy 101, advocacy during COVID. If you click on these, and then budgets and appropriations. She has little videos that she will tell you, or you can have at a glance what the PDF, or you can do slides. But I just want to go back here and show you their policy agenda, because I think this is probably one of the most important things. These are the policy agenda. They want, you know, protect and support IDEA 2004. And then it gets into more specifics. Protecting and expanding policies and programs that are outside of the scope of IDEA. You know, particularly the emergency COVID. I mean, that wasn't really part of IDEA, but it was a concern for children with special needs, particularly deaf and hard of hearing. How do we communicate, you know, if they're auditory oral and they can't see your face? The children can't see your face. What kinds of, we need more money. We need to make sure that we have the right kind of equipment. How do we deliver home services when we can't go into homes? So that was out of the scope of IDEA, but it was still a concern. So they advocate for that. Want to strengthen the professions that provide special interventions. You know, and right now there's a big push because of the teacher shortage. They want to make sure that higher education institutions are using standards that CEC has developed. Want to lead efforts to make sure that all public schools and early childhood settings and service providers receive the funding necessary. You know, bottom line is we need the money. Don't tell us you're going to fund it at 40% and then don't. And then we want to make sure that we have safe, inclusive, and supportive schools. So that's a principle that we're priority. And so we want to make sure that congressional committees, we want to work with them. We don't want them to develop restraint and seclusion legislation without our input. I mean, it's so important that they hear from us. And so anyway, so these are the main principles. Again, like I said, there are white papers available. There's just so much just in this one little area. I do want to share. I thought, let's see here, if I can pull it up. I wanted to share, they do make these briefs. This is what I was talking about earlier. I'll bring this over here. This was from last year. They have developed briefs, and that would be like kind of like their platform. The one, of course, is that IDEA. It talks about the 4 parts of IDEA, and it talks about funding. We want appropriations for full funding of IDEA. We want the government to provide the 40% that they promised back in 2004. One of the other, this is all on IDEA, which is really good information and good facts for you have at a glance here. So this was the idea for funding. And then we had mental health, because there have been so many mental health issues. There were like 3 major in the teacher shortage. So it was the funding for IDEA, mental health issues, and then we wanted the third one here is we wanted the teacher shortages, educator shortages. So that's what we went last summer to the Hill, and we talked about it. So they didn't want to have too many things to work on. Mental health, appropriations, and the teacher shortage were the 3 major areas. And if this is not available on our website, I will make it be available to you. I will make sure that it gets there. The other thing that I wanted, you can get their policy briefs. You sign up for their policy briefs. You can read the blog, and then you can sign up. It's over to the side like that. Let's see if I can get back there. They have this blog, and it's on there, and they talk the Policy Insider. You can sign up for the Policy Insider. And these are all different, just kind of little papers on different things that they're supporting. Like for this one, for me, because I'm into early intervention, this one was very interesting to me. This one was really interesting too, because the quality of the teacher workforce data. I mean, not only do we have a shortage, but we have a shortage of quality. So there's lots of things we can advocate for. I hope that you will go to the CEC website, that you can sign up for these legislative briefs or the Policy Insider. If you don't sign up for the Policy Insider, then you can just set it to go there monthly, weekly, bi-weekly, however you'd like, but just know what's happening in Washington, D.C., because it will impact you. And we need to make our voices be heard. And so anything that you can do that you would like to participate, if this is an interest for you, I would love for you to email me. I do have that right here, or you can call me. That's my cell number. I'm happy for people to call me. Just if you're going to call me, text me prior to calling me if I don't know your number, because I might just think you're a spam call. So, but dlively@svsu.edu, that's my email, or 989-860-7456 is my number. And if you're interested at all in becoming part of an advocacy team for DCD, then please get a hold of me. So I'm going to stop sharing. And are there any questions?
So Debbie, this is Susie Tiggs. I am the director of MEC DHH. And as I'm thinking about advocacy as a professional, do you see that the advocacy efforts work best if the professionals are partnering together with parents as opposed to just working on our own as professionals?
No, I think it's important because in part of IDEA, it says that parents are participating in their child's education. I mean, that's one of the guiding principles. So no, I think parents, and there's a lot of educators that are parents of children with exceptionalities. I think that it's important because parents can tell the story maybe better than we can sometimes. And I think, no, we here in Michigan, we include parents, and at the national level, parents do participate. Not as much maybe as what we would like, but no, I would encourage parental. I think it makes your case stronger. You know, you have the educators and the parents working together, and the administrators. You want administrators too.
Thank you.
Are there any other questions?
This is Dana Kahn. I was just curious, you mentioned sort of learning about the timeline of advocacy. Are there times of the year that are better for us to plan on approaching our local, state, national politicians?
I would say the reason that we do it in July is one, they I don't want to say they have more downtime, but their time they're there in DC before they go home is when we meet. So, and because budgets, federal budgets and stuff are like October 1 to September 30th. A lot of budgets are like that it's important that we hit them up, you know, as their budgets are becoming, you know, they're planning their budgets. In Michigan, we meet in January because of appropriations. So it just depends. So I would say, really, if you establish the relationship with your legislative individuals, ask them, when's the best time? When do you start making decisions about your budget? That would be the biggest thing, because appropriations, you know, are so critical. So I guess I would ask them, because it might be different in different states. I'm not sure, but I know from CEC, at Michigan CEC, we do January and July. So, thanks. Any more questions? Well, with no more questions, thank you to the interpreters for interpreting and taking their time to do this on a Saturday afternoon. And thank you for everybody else that attended. And I hope that you receive, you know, kind of like advocacy is like a cookie. And I just gave you a little bite of the cookie. And hopefully it just was enough of a bite to get you excited about being an advocate for children and families with exceptionalities.
Debbie, thank you so much for this. This was really informational, great information and step-by-step plan of what to do next. So thank you so much.
Okay. Thanks, and happy winter to everybody. It's cold here in Michigan. So.